Hey, this is Dr. Chris Manning at White House Chiropractic. It's so hot outside that I called up Aaron. I said, Aaron, you want to do a podcast? We hadn't done one in a while.
It's been a while. It's been months.
Yeah, it has. I actually, it was funny because you told me that you thought the podcasts were a good thing, and I was just like, nothing's happening. And so what's happened now is we're getting patients in that are asking me questions, and instead of me sitting down with them for 10 or 15 minutes and going over everything, I just point them to the podcast.
I like
chart, and then you go right to the website, and then they find it.
Yes.
Or so anyhow, that's kind of what I want to do with this new thing that we're starting at White House Chiropractic. It's called Back School, and the reason we're starting the Back School is this: I want to make a difference in people's lives. I want them to have long-lasting results. Chiropractic care is a great treatment for people with back problems or people with health problems, but it's a passive type of a therapy or care. In other words, the patient just sits there and they get adjusted. And again, I get adjusted once a week. We've got great testimonials about chiropractic care, but unless you do something to change your lifestyle, the way you sit, the way you move, you're going to continue to have problems. There's a lot of people that come in to get great results, but so I've been wanting to do something more permanent with my patients.
Okay.
And so we're going to start a back school. And so what I'm doing right now is I'll get patients that come in and they're walking sideways and canes and stuff like that.
That's not
serious.
funny. I'm sorry.
Yeah. Oh, I know it's not. And so what I'll do is I'll just sit there and say, listen, in my own mind, I'm saying this patient is not going to make it. They're going to get cut on. They're going to be in worse shape. We're going to get the pain clinic. I need to spend time with this person. So what I'll do is I'll have them go through a couple of movements and postures, and we'll find out what relieves their pain, and we'll find out what makes their pain worse. And so we do activities or motions where we avoid the painful posture position, and then we do things that encourage no pain and get rid or reduce the pain.
Right. And
from there, we offer them exercises that will encourage the good position to hold their spine in place so they don't have pain. But it's been really good. The guy that I'm studying has got Dr. Stuart McGill, and there's another guy, one of his students, that is a doctor of physical therapy. But they've got some really good information that I like, and so we're putting it in with our patients.
What is it going to be? What does it consist of?
Okay, so there are certain movement patterns that we all do just based on if we sit all the time. If you sit, you're in a flex position, and so when you stand, you're going to be in a flex position. And so what'll happen is people that have these flex positions, or what I call poor postural positions, they don't move very well. And so if you got forward head posture, that's not good, because your head weighs 10 pounds. When it's sitting straight up on your head, on your spine, it's perfect. It's right at 10 pounds. But every inch it goes forward is another 10 pounds. So if it goes forward 2 inches, that's 30 pounds.
Yeah.
So then you don't think about that. And if you're sitting like that at a desk all the time, the muscles in the back of your head are pulling down 30 pounds to hold it up in the bent forward position. And so that's where we get all kinds of issues with neck pain, headaches, shoulder pain, even lower back pain. I mean, it's something as simple as this. We had a guy that was like 86 years old, and he was like giving me this, I'm on a fixed income, this, that, and the other. And it's like, okay, all right, fine. And he was a friend of the family's. And so I basically took him into the office, and we found out some really simple things that he was doing, but his head was poked way forward. And so his back was holding the weight of his head up. And so I said, okay, Bill, what happens when you stand up and pull your head back and put your hands behind your back? Nothing, the pain goes away.
How about that?
Voila. So what happens when you go back forward again? It comes back.
Well, don't do that.
Right, what is it? It hurts when I do this.
Yeah.
Don't do it, okay? And so we're working on getting him to avoid positions or postures that are painful. And so he's what we call flexion intolerant. So in other words, when he flexes forward, he starts to have disc problems and leg pain. And when he sits upright, he feels better. So, it was really simple. So what we did was we worked on things that would strengthen him in the upright position. Like we had him pull his neck and shoulders back and hold for 10 seconds.
Okay.
We had him he couldn't do a hip hinge. Now a hip hinge is really simple. Basically, what you do is you stand up with your feet about shoulder width apart, maybe a little bit further, and you just drop your butt back and you hinge at the hip. Well, when he was trying to do that, he was bending at the knees, but he was also bending at his back. And that was a movement pattern that he had adopted over years, probably because of his forward head posture. So we're adapting or assuming certain positions or postures throughout the day, and it affects our movement. It causes pain, it wears down our joints. And so this is all about just really simple stuff. It's not that difficult. And so there's a flexion intolerance. That's somebody that can't lean forward. Now this is funny. I've already had about 5 people that I've spent one-on-one time with here, usually about an hour, and I don't charge them. But so one of the first things he asked me, now how in the world am I going to put my shoes on if I can't bend forward? I'm like, well, let's calm down. Let's figure it out now, because he's flexion intolerant. So I said, get like that. He says, I use a shoehorn. Okay. And so he's coming down here and like this, and I said, well, hold on a second. How long is your shoehorn?
I bet it's a little bit.
It's about that long. Okay. So
he used to get one of those.
I'm like, dude, I'm helping you so much, but this is so easy. Get a longer shoehorn. He's 86 years old. He's a great guy. He's a salt earth guy. And so we got him to where if I could sit sideways like this. So a lot of people will bend forward like this, okay? That creates a lot of stress on the spine. We're teaching them to hinge at the hip right here, like that, okay? And we'll go over some good movements that you should be really good at if you don't want to be in a nursing home when you get older.
I don't.
Yeah.
I prefer not to.
The hip hinge is great. If you can do a good hip hinge into your 80s and 90s, you're going to be pretty good shape.
Hip hinge. Be a great name for a band.
So basically the people that sit on a turlet, they can't get up.
Well, my pops is 86, will be in October, but he's got Parkinson's.
Does he?
Yeah, but he has trouble.
Does he?
Yeah, getting up.
Of
course, his knees hurt. He's
right. So we'll take somebody like your pop, and we'll look at his forward head posture and his sloped shoulders. See, there's certain postures that people adapt to on a regular basis. So if your head is slouched forward, your shoulders are slumped forward, your muscles are going to be turned on all day long. They're going to be tense because your body's trying to hold itself up as you're falling forward. So somebody that's falling forward cannot do a hip hinge.
Right.
What you got to do is get them to come back, and they have very weak hips, and all the work is being done by their back muscles. And so we work on just, you just have some of the people stand up and it's like, pull your head back. Oh, wow, that feels better. It sounds like kindergarten stuff, doesn't it?
It sounds basic.
Right.
Yeah.
But now their doctors tell them this, and I'm telling you it works. And so what we do is we find out what motions they're not tolerating well that are causing pain. We avoid those. And usually it's a motion where their head is already forward and they can't bend forward. Does that make sense?
Yes.
So all this tissue has been torn in the back for all these years. So we just work on pulling their head back, and we work on tightening the muscles or stabilizing the core in this position so they move with their hips and their shoulders and they have a stable spine. It's all about stabilizing the spine. And so then there's other people that can't handle loads. And so if you're flexed forward, we have this one test where we do a heel drop where they stand up on their tiptoes and they slam their heel. And if they have pain in their typical posture where their head's forward, then what we'll do is we'll have them pull their head back and change their posture to where it's better and more normal. They'll do it again, and they may have less pain. And then what we'll do is we'll have them brace. You say, hey, brace, like Michael Tyson is going to punch you in the stomach.
Oh, wow.
And you brace, pain gone. So what that means is their core muscles aren't even working. And most people that sit a lot, their core muscles just shut down. So,
standing desks. Try to get one.
Yeah, that's a good idea. And then extension intolerance. Some people can't bend backwards very well, and so what we'll do is we'll put them in more of a flex position, and it's real easy, and the patients understand it real well. So there's a couple of core stabilization exercises that we use with our patients. There's something called the Big Three. They're exercises that I've shown patients over the years, but a guy named Stuart McGill has really brought these exercises to the forefront of people with severe back pain, and so he calls them the Big Three. And so you'll have the side plank, the abdominal brace, and what's the other one? Come on, the bird dog. Yeah, the bird dog. So those are the three for, in his opinion, that are going to work to stabilize your core. And in addition to that, you work on avoiding postures that are painful, and you do postures that reduce pain.
That makes sense.
And so he stabilizes your core with you in a good posture. That's what we do. That's what we're doing. There's a couple other ones, and we adapt these. We can regress them and make them easier, or we can progress them and make them harder for people, even athletes. And so then there's a hip hinge, there's a thoracic brace. Basically there's about 5 to 6 exercises that we use that really help our patients. And this is the other thing. A lot of people don't understand this, but they'll be doing sit-ups to strengthen their core. A good core, what a core does is it stabilizes your spine and prevents it from being injured. And so as we get up to be like 30, 40 years old, every one of us has some type of disc damage or joint damage in our spine from poor posture, repetitive stress injuries, or from trauma. And so what will happen is those, like say if you've got a disc, I wish I had my spinal model here. If you have a disc, it's like a jelly roll that's sitting between 2 vertebrae, and it actually attaches to the bone above and below, so you cannot slip a disc. But what will happen is that disc will tear, and if it's like a jelly roll analogy, the jelly will ooze out, and it oozes out back towards the nerve. It's kind of like a flat tire. Have you ever driven a car where you had one flat tire?
Yes.
And you're driving, you can almost tell what tire is flat,
yes.
Right? Because it wobbles, it's
right.
Unstable, okay? So that disc is unstable. Your spine is basically a vertical rod segmented into 24 parts. And there's these jelly rolls between each of them, okay? You're not getting hungry, are you?
No.
Okay, I saw you salivating or something.
No.
Okay, all right. Anyhow, I'll get you one if you want.
A jelly donut?
A jelly donut, yeah.
Oh, okay.
I don't want one. The weather's too hot. But so these jelly rolls, where there's been damage to the jelly roll, it's not stable on its own. So there's a lot of people that do a lot of bending, lifting, and twisting without even stabilizing that unstable disc or jelly roll. And so what happens, it's allowed to shear, okay? And so all we do is we work on improving the posture, stacking those vertebrae on top of one another, and then strengthening the core. The core would be like guide wires on a cell tower.
Makes sense.
Okay.
Yeah.
So if you can vertically stack and stabilize your spine, you're going to limit your pain. You're going to reduce your pain greatly, but you're going to improve your mobility. Your activities of daily living will improve. And see, chiropractic doesn't do that. It does some incredible things. It improves the pathway of communication between the brain and the body, which there's nothing else that can do that. But I'm trying to get my patients to hold their adjustment better. And so if I can get them to, work on this back school.
I like that.
And, show them, hey, this is what's happening. A lot of people don't really realize how bad sitting is for you.
Yeah.
They just don't.
It's the new smoking. I've heard somebody say that. It's the new smoking.
Really what you've got to do is you have got to set an alarm every 20 minutes to stand up, get out of your chair, and do I call it a back brace, a hip hinge. Come out of the chair and do a hip hinge. And we show that to our patients. So anyhow, I'm really excited about this. So we're trying to implement this in our office. So it's really easy. But I've been showing patients, I mean, we'll see 40 or 50 or 60 people in a day, and I'm sitting there busting my tail trying to show them these exercises while we're working on them. And it's just beating me up. And I just say, you know, I've got to figure out a way where we can get this information out to our patients. And so that's what we're wanting to do.
I like that a lot.
So anyhow, okay. Well, what we're going to do next is we're going to film me doing some of these core exercises so our patients can see them.
Good.
All right.
All right.
Hello, this is Dr. Chris. I'm going to show you some exercises, core stabilizing exercises. This is part of our back school. So there's 3 exercises that we call the big 3. I wasn't the first to name them, Dr. Stuart McGill was. So this is the first one. And this is for core stability, which will help stabilize your spine and keep you from having so much pain. All right, so what I want you to do is put your hands underneath your lower back. Keep your spine in a nice straight position. And I want you to lift your head, just like this. Now notice my spine is perfectly straight, but I'm strengthening my core muscles in the front. We hold this for 10 seconds. And we set it back down. And you do that for 3 sets. Okay? All right. So the next one I'm going to show you is the side plank. The side plank is for strengthening the side of our spine and the side of our hips. So when we lay on our side like this, you put your elbow up here, you put your knee down here, and your hips are bent like this. And when you lift up, you straighten. And you hold this for 10 seconds. And then when you come back down, you bring your legs and your hips back like this. Okay? And then you go over to the other side and do that as well. The next one I'm going to show you is the bird dog. It's going to give you stability in your neck and upper back and shoulders and in your lower back. So the way the bird dog works is I'll be on my hands and knees, just like this, and we keep a good posture. And what I'm going to do is I'm going to pull out one of my arms or one of my legs. I'm going to create a torque in my spine. And what I'm going to do is I'm going to hold my spine in a neutral position. And so this is going to help my spine become more stable when I'm lifting, turning, and bending during the day. Okay? Now you don't have to pull it up like this. You may just be able to pick it up like this, but notice my spine is staying neutral. You hold that for 10 seconds. You put your hand down. And we're going to do the leg. Now, a lot of people will do this, but look what happens to my spine. So we want it to be just like this. We want the spine to be in a neutral position. And that's going to be very beneficial for strengthening our core. Okay. Next, we're going to do one arm and the opposite leg. So I'm going to do the left arm and the right leg. And again, you keep your spine stiff and rigid. And you do this and you hold this for 10 seconds. And you come back down. Now, if you want to do a little bit more, what you can do is you hold the arm up and you hold the hip up. And then you bring your hand to touch your knee and come back up while keeping a flat back. Okay? All right. So, those are the big 3. We've got the abdominal brace, which is going to stabilize your rib cage onto your pelvis. We've got the side planks, which is going to stabilize your upper body onto your hips and your lower back. And we've got the bird dog, which is going to help hold the shoulders together, square over the pelvis. So there's another one that I want to show you. It's called the thoracic brace. Now this is another good one. This one is for strengthening the neck and the shoulders. Believe it or not, your scapulae they basically hover over the back of your rib cage. They're held together by 15 muscles on each side. And so if you've got sloped shoulders or forward head posture, it's really going to create a lot of problems with your shoulders. So what you've got to do is you pull your shoulders back and pull them down. And take your thumbs and turn them out like this. And then pull your head back. Okay? Now, if you do any of these core strengthening exercises and they cause pain, we can modify them. If you feel like you're not being challenged, we can sit down and get really specific and make them more of a challenge. The greatest thing about these core exercises, though, is it does not put a load on your spine, and it really strengthens these muscles. So what you need to do is do each of these exercises, hold for 10 seconds, 3 repetitions on each of them, or 3 sets, 10 seconds on each of them. So I want to show you the hip hinge. A lot of people will, when they bend down, they'll bend at their back instead of their hip, and that's going to create a lot of back issues. Your hips are ball and socket muscles. They're meant for bending at the hip. Okay, so let me show you how that works. Take a shoulder width stance. You just put your hands out in front of you, you come down. See how my back is flat? Okay, that's what you want. Notice you're sparing the back when you do that, and that's what you want to do when you bend over. Instead of bending down like this, see how my back is curved? That's creating a lot of problems for people. So we keep the spine rigid, we come down like this, or we kneel down like this with a flat back. All right? When you're seated in your car, you want to sit up close to the steering wheel so you're not bent forward. So those are just different postures that people get into that create a lot of problems. So I think that's it. Okay, make sure you do your exercise and have a great day. If you have any questions, see me at the office. Thanks.